Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Can I come in?
Of course, please take a seat. What brings you here today?
I was diagnosed with breast cancer 4 years ago and underwent a mastectomy followed by chemotherapy. Last year, I was diagnosed with another cancer, this time in my ovaries, and underwent surgery for it as well. Recently, I've noticed I have difficulty breathing and a persistent cough.
I'm sorry to hear that. How long have you been experiencing these symptoms?
It started about 3 weeks ago, and it's been getting progressively worse.
Do you have any other health conditions or previous surgeries aside from what you mentioned?
Just the 2 cancer diagnoses. I also had an appendectomy when I was a teenager.
Are you currently on any medication?
I'm taking tamoxifen for the breast cancer and some painkillers as needed.
Any known allergies to medications?
I'm allergic to penicillin.
Can you tell me about any family history of illness?
My father passed away at 68 from lung cancer, and my mother has high blood pressure. My elder sister was diagnosed with uterine fibroids, and my younger brother has asthma.
All right, let's take a look at your lab results. Your white blood count is slightly elevated at 15.2, hemoglobin is at 13.1, hematocrit at 40.7, and platelets at 220,000. Your chest x-ray shows some haziness in the lower left lung field. Given your medical history, especially with the 2 cancer diagnoses, we need to be thorough in our investigations.
What do you suggest, doctor?
I recommend we do a CT scan of your chest to get a clearer picture of what's happening in your lungs. It's important to rule out any metastasis or other complications. Additionally, given the persistent cough and difficulty in breathing, I'll prescribe you an inhaler to alleviate those symptoms temporarily. Once we have the CT results, we'll discuss the next steps.
Thank you, doctor. I appreciate your thoroughness.
You're welcome. It's essential to be proactive with your health, especially given your history. We'll get through this together. Please schedule the CT scan as soon as possible, and I'll see you after that.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good afternoon.
Good afternoon. How can I help you today?
Doctor, I've been experiencing severe stomach pain and bloating for the past month.
Where exactly is the pain located? Is it constant or does it come and go?
It's around my navel and sometimes a little to the right. It comes in waves, but has been persistent for the past few days.
Have you noticed any changes in your bowel habits or any other related symptoms?
Yes, I've had constipation followed by episodes of diarrhea. I've also felt nauseous on occasion.
How about your appetite?
It has decreased significantly, doctor. I barely feel like eating.
Do you have any other medical conditions or have you had any surgeries in the past?
I was diagnosed with type 2 diabetes last year, and I had an appendectomy when I was a teenager.
Are you on any medications for your diabetes?
I take metformin 500 milligrams twice daily.
Do you consume alcohol or have a history of smoking?
I drink occasionally, maybe once a month, and I quit smoking 5 years ago.
Any family history of gastrointestinal diseases or issues?
My mother had irritable bowel syndrome, and my grandfather had colon cancer.
Okay, let's have a look. Upon palpation, your abdomen seems tender, especially around the right lower quadrant. Given your symptoms in physical examination, I suspect it might be Crohn's disease or perhaps a form of IBD.
Oh, that sounds serious. What's the next step?
I'm going to order a colonoscopy for a closer look. In the meantime, I'll prescribe you some pain relief and an antispasmodic for the abdominal pain. It's crucial that you follow up after the colonoscopy so we can discuss the results and determine the best treatment plan.
Thank you, doctor. I appreciate your help.
You're welcome. Take care, and please don't hesitate to contact the clinic if your symptoms worsen.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So, now that we've placed the braces on, how does your mouth feel?
A bit odd, to be honest. I thought I'd be in immediate pain or feel a lot of discomfort. It's more like a tight sensation. Though my cheeks feel a bit raw against the metal.
That's quite normal for the initial adjustment. The cheeks might take some time to get used to the braces, but I can give you some wax to apply over the braces to help reduce the irritation. In a few moments, I'll show you how to apply it.
I got the hang of cleaning around them, but I'm concerned about eating. Will I damage anything if I eat something crunchy?
It's a valid concern. I'd advise you to avoid extremely hard or sticky foods. With time, you'll figure out what's comfortable for you.
The alignment feels a bit off when I bite. It's not smooth.
It'll feel that way initially. Give it some time, and your bite will adjust as your teeth begin to move into position.
Now look at question 26.
Jane, can you assist me with Mr. Richards in room 7, the one with the knee replacement last week? Yes, I remember him. He's starting his physio today, right? Did he express any concerns? I noticed he seemed a bit anxious about moving his leg. Exactly. He's a bit apprehensive about putting weight on it. I was hoping you could help demonstrate some of the exercises while I guide him. Of course, it's always a bit nerve-wracking the first time post-surgery. Has the orthopedic surgeon given the all-clear on his range of motion? Yes, the surgeon said he can start gentle exercises, but I want to ensure we give him the confidence to move without fear. All right, let's first get him comfortable and reassure him about the process. It's essential he knows we're here to help. Perfect.
Now look at question 27.
We've always aimed to bring in technologies that benefit both our patients and the healthcare team. We recently integrated a system called Patient Connect into our database. This system lets patients access their medical records, appointments, and even chat with their doctors through a secure portal. They can also input any allergies or side effects they might be experiencing from medications. It ensures that patients feel more involved and informed about their healthcare journey. The feedback has been overwhelmingly positive, with many mentioning how it gives them a sense of ownership over their health. Given its success, we're looking at introducing it across our network of clinics and facilities.
Now look at question 28.
I had a discussion with Mrs. Allen's GP. She's been having intermittent chest pain, not very severe, but it's recurrent. They initially thought it might be acid reflux, but now they're leaning towards a cardiac cause.
Have they done an ECG yet?
Yes, but it's inconclusive. They're contemplating an angiogram.
Before going invasive, wouldn't it be better to start with a stress test? We can see how her heart reacts to exertion and if there are any changes in the ECG during the test.
That sounds reasonable. But if the stress test doesn't show any issues and the pain persists, what's our next step?
Then we might consider an angiogram or maybe a cardiac MRI. It's crucial to pinpoint the cause, but also essential to subject the patient to the least invasive procedures first.
Agreed. Let's suggest the stress test and take it from there. I'll relay this back to her GP.
Now look at question 29.
Let's discuss Miss Patterson's case. She's up for a total knee replacement. Are there any concerns from anesthesia's side?
She has a history of asthma. It's managed, but will have to be prepared. She also mentioned that she gets quite anxious before surgeries.
We should ensure there's a bronchodilator available then. Do we need any special positioning for her?
Standard position should work, but I'll be ready to adjust if she has any respiratory issues. Given her anxiety, would you consider a regional block, maybe a spinal or epidural, combined with sedation instead of general anesthesia?
That sounds reasonable. She did express concern about post-op pain. A regional block might provide better pain relief immediately after the surgery.
Agreed. And if she's open to it, we can add light sedation to keep her comfortable.
Now look at question 30.
One of the initiatives we're excited about is the introduction of telemedicine consultations. With the advancement in technology and the current state of the world, it's vital to offer patients alternatives to in-person visits when possible. Yes, especially for those with mobility issues or those living in rural areas. Telemedicine can provide a lifeline, ensuring they receive timely and quality care. There's evidence that such setups can significantly improve patient satisfaction rates and reduce no-shows for appointments. It's also beneficial for follow-up consultations where physical examinations may not be as crucial. What about the concerns regarding technology barriers for older patients? It's a valid point. We're working on introducing simple interfaces and providing training sessions for patients unfamiliar with the technology. We'll also have a helpline ready to assist with any tech-related issues. That sounds promising. Our focus should be to ensure that while we embrace technology, we don't alienate any patient demographic.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, I'm Dr. Emily Carter, a clinical psychologist specializing in mental health care. Today, I'd like to share insights from my profession, focusing on the work I do and using a case study, let's name her Mia, to highlight the intricacies of mental health care. Mental health concerns are rapidly becoming a significant health challenge. In the UK, approximately 1 in 4 people will experience a mental health problem each year. With increasing awareness, the stigma attached to these conditions is slowly diminishing, but a lot remains to be done. Anxiety and depression remain the most prevalent mental disorders, but many might not recognize the early symptoms, such as persistent sadness, excessive worry, or fatigue. Hence, raising awareness and ensuring timely intervention is crucial. Mia, a young professional in her late 20s, began feeling consistently overwhelmed and anxious. Initially attributing it to work stress, she tried to cope using meditation and relaxation techniques. However, she soon found herself unable to concentrate, losing interest in activities she once enjoyed and distancing from her friends. Concerned about her well-being, she finally sought professional help. Her therapist identified early signs of a depressive episode combined with generalized anxiety disorder. Therapy sessions revealed underlying issues, including unresolved grief over a family loss and pressures stemming from societal expectations. Mia's therapeutic journey involved cognitive behavioral therapy, CBT sessions, where she learned to recognize and challenge negative thought patterns. She also attended group therapy, providing her with a platform to share experiences with others going through similar challenges. Just as with any health condition, individuals' reactions to mental health issues vary. Some might downplay their feelings or avoid seeking help due to societal or self-imposed stigmas. Others might struggle with medication side effects or find certain therapeutic methods challenging. There's no one-size-fits-all approach. Some might benefit from talk therapy, while others might find relief through medication, lifestyle changes, or alternative therapies. In my area, we've introduced community therapy clinics, providing an accessible platform for individuals to seek help. These clinics act as a bridge, offering primary counseling sessions, group therapy, and workshops. Building rapport is easier in such settings, allowing for more personalized care. Feedback suggests that individuals find these community clinics less intimidating than traditional clinical settings. We might not have concrete statistics to emphasize their impact yet, but the anecdotal evidence suggests that such initiatives are making a significant positive difference. It's our hope that similar platforms become more widespread, providing accessible mental health care to all. Thank you for your time, and remember, mental health is as vital as physical health. Let's continue spreading awareness and ensuring everyone gets the support they need.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon. I'm Dr. Lisa Marshall, a sleep specialist with a focus on the growing concerns around the use of sleep medications, especially benzodiazepines and over-the-counter sleeping pills. Many call this the unnoticed crisis. While society often focuses on addictions related to narcotics or alcohol, an increasing number of individuals are becoming reliant on sleep aids. Unlike some other addictions, dependency on sleep medications spans across various age groups, backgrounds, and professions. A significant portion of those using sleep medications initially receive them through legitimate prescriptions. However, without adequate monitoring, what starts as a short-term solution can quickly become a long-term crutch. Physicians need to weigh the benefits against potential long-term reliance and side effects. In the digital age, with screen exposure and erratic schedules, sleep disturbances are becoming common. The demand for immediate solutions has led to an upsurge in prescriptions and self-medication with OTC sleep aids. While they might offer temporary relief, they don't address the underlying causes of sleep disturbances. Much like pain, sleep isn't just an off-on condition. The reasons for sleep disturbances are multifaceted, including stress, lifestyle, medical conditions, and more. It's essential to differentiate between transient insomnia and chronic sleep disorders. Many believe that over-the-counter sleep aids are harmless given their easy accessibility. While they can be beneficial occasionally, regular consumption can lead to increased tolerance, side effects, and a disrupted natural sleep cycle. People often combine sleep aids with other medications, not realizing the potential harmful interactions. This can intensify side effects or even lead to unforeseen complications. Greater public awareness and physician education are crucial. James, a 40-year-old software engineer, struggled with sleep due to work-related stress. He started using an OTC sleep aid, eventually moving to a prescribed benzodiazepine. Over time, his reliance grew, affecting his work performance, personal life, and health. He realized the pills were a temporary fix, masking his underlying issues. James sought help from a sleep therapist, learning techniques like cognitive behavioral therapy for insomnia, CBTI. He understood the importance of sleep hygiene and started making lifestyle changes. It wasn't an easy journey, but with determination, he regained his natural sleep pattern. Healthcare professionals should prioritize sleep education and promote natural methods before prescribing medications. Setting clear guidelines, understanding the patient's history, and monitoring progress are pivotal. Sleep is vital for our well-being. While medications can assist in specific circumstances, it's imperative to address the root causes of sleep disturbances and promote natural, sustainable solutions.